Hello everyone, welcome back to my channel. And today the topic of discussion is bronchial asthma, a condition, respiratory illness that we see in our day-to-day clinical practice. Very common, but very challenging for the patients, and it actually affects millions of people around the globe. So let me take you through what exactly it is, why it happens, and how to manage it. Now, bronchial asthma is actually a long-term inflammatory condition of lung airways. So the airway in our lungs get inflamed, and this is a recurring kind of condition where there is airway obstruction and eventually what is called as bronchospasm, which give rise to all the symptoms. Now, when we see these symptoms, the patient will have wheezing. They will come with bouts of cough, chest tightness, as if they are not able to expand their chest and breathe in properly, and shortness of breath. Now, generally, this is of abrupt onset. So, all of a sudden, the patient will come up with these symptoms. And generally, these symptoms are worse during the night or midnight rather, and on excessive exercise. Now, when we try to understand the causes, a lot of patients have a genetic predisposition towards bronchial asthma. And a lot of patients can have an atopic condition where their immunity is such that they are prone to develop bronchial asthma. Some patients have a hypersensitive or hyper-responsive airway. If around the living conditions of the patient there are allergens that can make the patient allergic and eventually give them bronchial asthma. Sometimes occupational causes are there where the patient is working with certain or around certain allergens. Passive smoking can also cause bronchial asthma, especially in pediatric cases we see this. Again, obesity can also prone the patient. Other kind of respiratory infections and air pollution. This is something that we are seeing in growing numbers, as air pollution being the prominent cause of bronchial asthma in a patient. Now, what are the pathological areas that we see? When we see the airways, the patient's airway become hyperreactive and there is increased bronchoconstriction. The blood cells are seen rising in number. There is a lot of mucus production. The airflow is reduced, so FEV goes down. Now, we actually classify bronchial asthma into two types depending on its presentation. One type is called as extrinsic bronchial asthma, another type is called as intrinsic. Now, with the term itself, you understand that with some external factor, the development of disease happen. Usually, this has a early onset development, and a lot of cases will have positive family history. Whereas in intrinsic, it's usually the autoimmunity of the person or allergic condition, and this in majority of the cases will develop late, and sometimes over 30 years of patient bronchial asthma will develop that will have an intrinsic pattern. Now, what are the signs that we examine? When we do the respiratory examination, we will see that the accessory muscles of respirations are used. Pulsus paradoxus is observed, and patient can have depression, depressed sensorium. Okay. Of course, wheezing will be present. Breath sounds will diminish depending on the extent. There will be signs of chest hyperinflation, stridor can be positive. When we go for the sputum examination of the patient, there can be rise in the eosinophil count, and patient can have mucus plugs. Now, when we go for pulmonary function tests, which are generally advised in these cases, obstruction will be noticed, and when we go for spirometry, FeV1 will be reduced. Chest X-ray will show hyperinflation of the lungs, and lobar collapse can also be present. Now, other differential diagnoses that must be kept in mind are, with similar presentation, are foreign body aspiration, especially in pediatric OPDs. We must think of that. COPD in elderly group of patients, chronic heart failure, and any airway masses can present with similar condition. Now, generally, the prognosis of the patient is good for bronchial asthma, and homeopathy has a wonderful role where we can manage the cases of bronchial asthma and can give them a long lasting effect, a positive effect, and can help them have a good quality life. So some of the remedies along with their key indications I'm going to write down so that you can think of these remedies according to individual presentation of the patient. Now, blata is one of the remedy that is often given where there is pus-like mucus coming from the mouth of the patients and the patient come with bronchitis. Grindelia, again, in low potencies is given where the patients have foamy mucus and the patient has aggravation on lying down. So whenever he tries to sleep, it's very difficult. Another remedy that you can think of is Ictodus fetalis. This remedy has an associated anxiety and the patient is relaxed after passing stool. Another remedy that you can think of, Senega, where the patient cough and then has a sneeze. So cough ending in sneeze is a very specific feature of Senega, and often in geriatric OPDs you can use this remedy. Another remedy you can think of is Antimonium Ars, which has a lot of dyspnea, which is worsened on eating, and lying down. Another remedy you can think of is Aurelia, where again on lying down the patient feels worse, but this generally has a dry kind of cough. Very, very important remedy is Antimonium tartaricum. Here there is excessive rattling because of too much mucus present in the chest of the patient, and dampness as an underlying cause or worsening cause. Another remedy that you can think of is natrum sulph, where patient has worsening from an episode of grief and dampness, even in damp weather, and the sputa is greenish in color. Another remedy, very important one, ipecac, usually given in the first stages of bronchial asthma or in the early cases of bronchial asthma. Spongia, this is a remedy thought of when there is dry kind of cough, throat is completely dry and the patient is worsened on any kind of mental excitement, and eating sweets of any kind worsens the symptom. As a constitutional or intercurrent remedy, you can think of tuberculinum, it is a nosode. Bromium, another remedy, people living around the shore area. If the patient comes to you with midnight aggravation, specifically, you can think of Sambucus. And a remedy wonderfully working on the tubes. So when the tubes get thickening of the tubes, think of Eriodictylon. In low potencies, it works wonderfully. So this is all about bronchial asthma and its homeopathic therapeutics. I hope you like this video. Please subscribe the channel for more such discussions, and I'm very, very glad that you're liking my previous videos. Thank you very much.